Awesome. Thank you. So again, welcome to this monthly housing topical webinar. These monthly topicals are put together based on what our trainers hear kind of out in the community and from direct service staff about what information you want to learn more about. And we try to get it to you in this form in kind of the predictable monthly webinar setting. So for the rest of the year, you can kind of expect topics to include fair housing updates and how to navigate some of the unique resources that we have in Washington, and then some deeper, really deep dives into available subsidies in our community. Over the last couple of months, the development of Apple Health and Homes has been a topic that has high interest from just about everybody across the state. So today, personally, I'm thrilled to introduce two of the fiercest advocates for supportive housing, who are also incredible key change makers within the state level programs. So Scott Tankersley is with us today. He's the Housing Subsidy Program Manager within the Division of Behavioral Health and Recovery, and he's on the Foundational Community Supports team. And then we have Melody, our other presenter today, who's with the Washington State Commerce, and she oversees the Office of Apple Health and Homes and Permanent Supportive Housing. So Scott and Melody, thank you very much for your time today, and I will pass the floor to you. Are you able to share, Melody? Did I give you all the buttons that you needed?
Awesome.
Beautiful.
Thanks so much, Rayanne.
Yeah, of course.
For having us here today. I know that people have been really excited to hear about Apple Health and Homes, and so we're really excited to be here to be presenting on Apple Health and Homes. You know, HCA's FCS staff, I being one of them, have been working with partnering agencies, those being Commerce and DSHS, to build out this new and exciting program, which uses FCS Supportive Housing as the permanent supportive housing service component of the Apple Health and Homes program. And a large portion of Apple Health and Homes is managed by Commerce's new Office of Apple Health and Homes and Permanent Supportive Housing. And I'm thrilled to be joined by Melody Pazel, the director of the Office of Apple Health and Homes. And she'll be joining me throughout this to present to you about the structure of the program. So with that, though, first we'll be giving a brief overview of social determinants of health and how you know, those are addressed through the Foundational Community Supports program goals. And we'll be focusing more specifically on those supportive housing services within the Foundational Community Support Service program. But we won't spend too much time there because I feel like a fair amount of folks here in the room know quite a bit about FCS. We really just want to set the stage, you know, and let you know that FCS really is the foundation of the Apple Health and Homes program. We'll cover, well, then we'll jump into Apple Health and Homes, which was a program that grew out of 1866, or HB 1866, which was a piece of legislation that came out of last year's, the 2022 legislative session. We'll talk about the eligibility for the program design, which involves a few different voucher types, and then AmeriGroup's role, as well as a few other people or entities and their roles as well. And then we'll talk about next steps towards implementation. Next slide, please. And so,
all right, do you want me to take this?
Jump into
Go
it.
for it.
Sounds good.
Scott and I are going to tag team, so we're going to maybe step on each other a little bit, but you know, we're going to partner for sure and really rely on each other's expertise. And I couldn't think of a more wonderful person to co-present with, and just so happy to be back working with you all and working with the Healthcare Authority team and all of you in the FCS and the housing world to bring this new initiative and really further how important housing is to people's recovery in from chronic health conditions, from behavioral health conditions, from long-term care needs, that housing plays such a crucial role in that recovery. You know, if you have been hospitalized, you know, with a chronic health condition or, you know, behavioral health condition and institutionalized, or, you know, in an inpatient setting or in a substance use treatment program and released to homelessness, you're not going to, you know, get better without having a stable roof over your head. without a healthy environment to lay your head. And housing plays such a huge role in your health. And so it's really cool and so crucial that the healthcare system, the behavioral health system are really recognizing how important these social determinants of health are playing in people's healthcare, in their recovery from healthcare and behavioral health conditions. And now it's how do we bring all of these pieces of the puzzle together, the systems together to try and bring really truly whole person care, healthcare together. So housing is really a cool, important role. And so bringing social determinants of health and this important focus on supportive housing. So with that, we also know that permanent supportive housing is really steeped in research, and there's nothing that says that speaks to the system than how it saves the system money. So not only is it healthy and important to people's health, but it saves the system money. And so if we can actually demonstrate how effective permanent supportive housing is in reducing emergency room costs and reducing healthcare costs, that's also going to go a long way in helping expand permanent supportive housing. But it's really making also sure that we're doing it in a manner that is effective in following those evidence-based practice models. So we have to, do it following that recipe. But the permanent supportive housing model is really dependent on these three legs of the stool. You can't, and we were actually having this conversation in a workshop with counties the other day, and these three legs of the stool have been a metaphor for a long time for me around having rent assistance to help individuals, having capital, the bricks and mortar to build affordable housing, and the services to wrap individuals to help them be successful in housing, help them obtain and maintain housing. But if any one of these legs of the stool are disproportionate, your stool's gonna fall over. It's gonna be wobbly. And I think that that's where we are in Washington State, that the legs of the stool are disproportionate. We have, I think everyone knows, a very significant lack of affordable housing. There is a huge housing crisis in Washington State. And so I think from, all income bands are experiencing a housing shortage, but particularly for people that are that zero, the poorest of the poor, affordable housing. I have this huge housing shortage. And so that leg of the stool is really disproportionate. The services have been disproportionate in the past. There were no services. The homeless service delivery system was paying for the services in permanent supportive housing. And with foundational community supports on the scene, that pumped a significant resource into Washington State to be able to use Medicaid to be able to pay for the services. So now that leg of the stool is longer, I think, than even the other legs of the stool. I think that the rent leg of the stool, in order for individuals to actually, and for those housing operators to have rent subsidies to pay for, as well as to give individuals the opportunity to have choice in whether they want to go to a private market landlord, to have really true choice in housing, that we also need to make sure that the third leg of the stool, and to have rent assistance, also needs to be proportional to the bricks and mortar, to the services. And I think that that's really where we have a huge opportunity with Apple Health and Homes, because it's really trying to bring all three legs of the stool together. And we're going to share a little bit more about that in a little bit. What we have here is actually a little bit of an acronym list to share with you of where all some of those housing, some of those, I call them funding trickles, are for those three legs of the stool. If you're not familiar with these trickles of funding for these particular legs of the stool, I hope that you will be, because you as service providers need to help people navigate how to access these different legs of the stool to help them be successful in housing. But it's challenging. It's a complex world in housing. And so, but that's really where you all as service providers are really the experts in helping people navigate and learning which programs they're eligible for, and being able to help individuals apply for and be able to access all of these different resources. Scott, anything you want to add?
No, I think that you did a great job on that. Just want to highlight that you'll see some programs that you're probably fairly familiar with or here to learn about as well on that list. And, we are becoming part of that stool, and in fact, becoming the stool ourselves. And so that's a really exciting opportunity for us and the providers that are serving folks with FCS.
Here's my fancy
I love it.
Demonstration. One of the things that, as we, it's not just about how we expand permanent supportive housing in the state, but it's also about making sure that the permanent supportive housing that we're talking about, that we're all on the same page about what we mean about permanent supportive housing. As our unit has been developed over at the Department of Commerce, I'm learning that there are a lot of different interpretations about what PSH means. And I think that the fidelity to the model and having these principles of permanent supportive housing is really the cornerstone, and making sure that we're all on the same page about what PSH is and what it means, and having a recipe so that we're all on the same page and following these principles. If you have any question about what these principles are, the trainers at the Healthcare Authority, the supportive housing trainers are, so adept at providing training on these principles. And I know that there are fidelity review trainings to learn more about the incentives, about becoming, having a fidelity review, participating in a fidelity review, learning more about the fidelity reviews. And that's certainly something that I think we need to, fidelity reviews are not audits. It really is a continuous quality improvement approach to really trying to, again, follow a recipe to make sure that we are providing PSH in a manner that provides individuals the most opportunity, and that leads to the highest outcomes.
Absolutely. And I just want to add here, Melody, that, foundational community support, supportive housing more broadly, and then Apple Health and Homes as kind of a, subset of that group that's being served by supportive housing services within FCS. Those services are really modeled around these principles. And just to reiterate what Melody said, it's really crucial that they're performed to fidelity because of that, and I think that when we hit that fidelity space and high fidelity, then it's a really great way for us to make sure that we're serving people most appropriately across the state with the services in line with this model that we're using to create this program. With that, I just mentioned that foundational community supports is, following that fidelity model specifically with the supportive housing services. I just wanted to touch base with folks. I know that most people here probably already know what foundational community supports is, but just want to remind folks, as the program is the foundation for the Apple Health and Homes program. And so FCS was developed as part of Washington State's Section 1115 Medicaid Transformation Project waiver. And the MTP, or the Medicaid Transformation Project, really aims to improve the health of Washingtonians by coordinating healthcare stakeholders and addressing health-related social needs, like we talked about a bit earlier in the program. FCS is known as Initiative 3 of the MTP, and there are two benefits offered. It's supportive housing and supported employment. And like I said a bit earlier, supportive housing is the focus of the conversation today, as it is a crucial component of the Apple Health and Homes program. And so with that, just want to remind folks that AmeriGroup is a managed care organization that plays the role of the third-party administrator for the FCS program. And what they really do with that is manage the FCS provider network, and they authorize services and provide administrative oversight for the program. You'll see some goals up on the screen here. Those are the focus of the services, those pre-tenancy and tenancy sustaining services of the FCS Supportive Housing program, really hoping to get people living independently if that's their choice, to participate in competitive employment as part of their recovery. And then, these services are really designed to be integrated with other support services that an agency may be providing, including rental assistance programs such as Apple Health and Homes. Next slide, please, Melody. Unless you have something you want to add. And so with this, you're going to see, a bit of information or numbers from our partners over at RDA, or Research and Data Analysis, which is housed within DSHS, or the Department of Social and Health Services. Over 1.5 million folks are enrolled in Apple Health or Medicaid, and that is for state fiscal year 2020. 11% met the broad definition of homelessness or unstably housed during that same year. And if you need a little reminder on what the broad definition of homelessness is, that does include folks who are homeless with housing. So thinking of folks who are doubled up or couch surfing, if you will, folks who are experiencing literal homelessness or other indications of homelessness as well.
And this is the broad Apple Health Medicaid program. This is not who's enrolled in Apple Health and Homes. So we just want to remind folks that Apple Health is the name of the Medicaid program in Washington State, and that Apple Health and Homes is a specific initiative to try and assist individuals that are on Medicaid to help them, and that subset of individuals on Medicaid that are homeless, to help them with their health through the Foundational Community Supports program. So I just want to give that context that this is not who all is enrolled in Apple Health and Homes. It's Apple Health is the Medicaid program in Washington State.
Great reminder, Melanie. Thank you.
So House Bill 1866 passed in the 2022 legislative session. So this initiative, and I'll encourage you to go and read the bill, because the original concept for this bill, which was really exciting and is actually getting national attention, is really the concept for it was ideally prescription for housing. That's just a concept. We're not able to write a prescription for housing, but the idea was that building upon that social determinants of health, that housing and healthcare are so interrelated. And it really does build upon the cornerstone that people that are receiving foundational community supports, that have a healthcare, behavioral health, long-term care need, that are homeless and have these specific homeless risk factors, need that wraparound supports and need that comprehensive package to help them recover from their situation. And so it is really that concept of bringing all three of those legs of the stool together. And so it is the idea of bringing bricks and mortar, of bringing rent vouchers and subsidies and the supportive housing services together in one initiative. And so the concept of the prescription for housing is just a concept, and it really is how we operationalize this program. And it's really the partnership between the Healthcare Authority, AmeriGroup, Department of Social and Health Services, and Department of Commerce. All of our FCS programs, our housing operators, our housing partners, that bring our local government, that brings all of this together to make this program a success. I do also want to remind folks that permanent supportive housing can really come in different forms and models. So permanent supportive housing, and I think that we really need to think really about a paradigm shift in housing. And, particularly for people that have barriers to housing, that are in this social determinant of health, that are recovering from healthcare or chronic health or behavioral health conditions or long-term care needs, that we really need to think differently about what kind of environment do they need to be successful in. I oftentimes tell a story when I was working in a behavioral health organization, and I had a gentleman that I was working with that, heard voices, and part of his coping skills was he played music really loud, and that was how he coped with hearing voices. And the apartment that he needed, that he lived in, needed to be an environment that he could play that music really loud. And so we need to think differently about what kind of environment that person needs to live, to be successful in. And so finding an apartment, to his needs, and I know that that's really challenging when vacancy rates are 1%, when vacancy rates are, we have, such a low inventory of housing. I know that that's really challenging, but how do we get to that paradigm shift? And so we need to be thinking differently about housing. We need to be thinking about choice. We need to be thinking about the environment that person needs to be successful. And so that may mean a tenant-based rent assistance, a scattered site, or a single site. Maybe it's a hotel that's purchased. Maybe it's master, a bunch of single-family homes that are purchased. Maybe it's master leasing. Maybe that organization master leases a hotel, maybe, or a bunch of apartments in an apartment building. There are different strategies. Maybe it is a project-based housing unit that's built. So there are all these different strategies that are different options, and how we match individuals with those different options. And I think that that's how as we build this inventory of tenant-based, project-based rental assistance, as we build this inventory of capital, with purchasing more units, with building more units, it's how we build our stool. And again, that stool may be offset a little bit. The legs of the stool, aren't going to always be at the same level. They're going to be staggered for a little while as we build our inventory. But I want you all to be thinking about the individual's needs first and foremost, and what kind of environment that person needs to be successful. And as we build the inventory, then matching that person with the environment that they need to be successful. That's what should come first. And so be thinking about those different approaches and the different models to permanent supportive housing. And, with the need for building more capital, the state right now, there is a lot of conversation happening about the need for permanent supportive housing. If you're watching the legislature right now, if you've listened to the governor's present his budget and his priorities for this legislative session, there was actually a bill last year or 2 years ago for the Growth Management Act to project how much housing needs to be built in the next 20 years. And this bill, which was House Bill 1220, required actually another department within Department of Commerce to create a calculation based on population growth, how much housing is needed for all of these different income bands. So these are 0 to 30% area median income, 30 to 50% area median income, 50 to 80% area median income, and so forth. And so these are all of the housing units that are needed. So, Washington State needs almost 1 million units of housing built in the next 20 years. And they actually specifically looked at permanent supportive housing and said, we really need about 116,000 units of permanent supportive housing built in the next 20 years, based on just a medium, projection of population growth. And so if you are interested in learning more about this calculator, and you can actually dive in and see in your local community how much permanent supportive housing is needed in your local community, there's actually on the Commerce website this calculator, and you can actually go in and see in your community what how much PSH is needed. And when we send out the slides, or you can go on the Commerce website and just Google or search on the Commerce website 1220, and it will it will come up with that calculator. So we know that there's a lot of housing that's needed, but pay attention, because there is definitely a lot of effort around building more permanent supportive housing in communities over the next 20 years. So I just want to kind of highlight that because you're going to hear about that in this legislative session, and there is definitely in the governor's budget a referendum to actually build in the governor's budget, build more housing for both Apple Health and Homes, as well as a referendum to build housing across the state in the next several years.
Awesome. Thank you so much, Melody. Now we're going to jump into a bit of Apple Health and Homes eligibility material. And so you'll see a screen on your screen that says, who is Apple Health and Homes eligible? And one thing I want to highlight here is that Apple Health and Homes eligibility involves serving a subset of foundational community supportive housing enrollees. And so first, we'll just do a quick review of FCS eligibility as it stands now. So a person would need to be enrolled in Apple Health or Medicaid, otherwise known as Medicaid, right? And then be at least 18 years old to be receiving supportive housing services, okay? And then that individual would need to meet requirements for complex needs. And so typically, these are going to be medical necessities related to mental health or substance use disorder, activities of daily living, or complex physical health needs that prevent the person from functioning or successfully or living independently in their community. And then the individual would need to meet a series of, or one of a series of risk factors that's listed on our current assessment. And so you'll go to the next slide and you'll see the risk factors for the broader FCS program, supportive housing program. And then you'll see two crossed out at the bottom, the frequent turnover of in-home caregivers and the PRISM risk score, or the predictive risk intelligence system score of 1.5 or higher. So those two risk factors were not included in the legislation, the 1866 bill. Therefore, those two groups are not going to be brought into the Apple Health and Homes program, but they still can be served by foundational community supportive housing more broadly. With that, though, you'll see a few others above that that don't have strikes through them, and those are the core population for Apple Health and Homes. And so those are the folks that, while being assessed for FCS supportive housing, would enter into Apple Health and Homes as a subset of that FCS supportive housing program. Melody, do you have anything you want to add there?
Oops, my mouse got a little jumpy there. No, I just want to, I do want to just re-emphasize that Apple Health and Homes is a subset of the FCS program. And, certainly individuals can be dual enrolled in both supportive housing and supported employment, but the main individuals do have to be enrolled in the supportive housing benefit to be eligible for Apple Health and Homes. If they are enrolled in supported employment only, unfortunately, they are not eligible. They would have to be enrolled in both. I will say there is a new benefit, and for people that are transitioning, if somebody's obtained employment as a result of supported employment, There is a new housing subsidy that I think HCA just launched. And in partnership with Commerce. So check in with your supported employment folks about that new housing transition benefit to help those folks. That's really exciting. But unfortunately, those folks are not eligible for this benefit.
Great reminder, Melody. Thanks.
So how is it going to work? So this is, if anybody knows me, you know I like a good flow chart. And essentially this idea of the prescription for housing, that essentially an individual, you know, it has those barriers, they have a complex need, they have a medical, a behavioral health condition, a long-term care need, and so they are receiving and eligible enrolled in foundational community supports. And then they are that subset population and eligible for Apple Health and Homes. The foundational community supports provider does that housing assessment and identifies what kind of environment do they need. What do they want? A project-based voucher? Do they want a tenant-based rental assistance? Do they want one of the units created through our capital program? What kind of housing do they need to be successful? And they're going to communicate that to the coordinating entity. And that coordinating entity, it happens to also be AmeriGroup. AmeriGroup is going to be working with our platform, and to continue the metaphor of the prescription for housing, they're going to go to the pharmacy to fill that prescription. And the pharmacy is basically Commerce. And we're going to create a platform with our resources to fill that prescription. And whether it's the tenant-based rental assistance, whether it's project-based rental assistance, whether it's units created through the Rapid Capital or the capital programs, that the units that we're going to create through the capital program, we will then put those resources into that platform to try and make a match between what that individual's needs are and what we have available in our inventory. And so that's the matching that we want to try and do between the assessment that the FCS providers are doing with that individual and what we have available in our inventory. And so that's what we want to try and operationalize. Of course, the devil is in the details, and we are basically trying to build all of this as we speak. And so the next couple of slides are kind of where we're at in this process. But this is the concept. So first, the Apple Health and Homes creates the benefit and pairs supportive housing services for a subset of individuals enrolled in FCS. Housing and services are renewable in 12-month increments. So this is, part of the bill actually directed the Healthcare Authority to extend the authorization period for FCS from a 6-month authorization period to a 12-month authorization period. Right now, the Healthcare Authority is in negotiations with CMS for the, waiver. So there's a pin in that one while they're, in negotiations. So that's, they're still waiting for CMS to approve the renewal waiver, but that's in the works, but that's not the case at the moment. So it's still a 6-month renewal authorization period, but that was in the bill, and we're hoping that CMS will approve that with the renewal. Of course, there's a lot of collaboration between the Healthcare Authority, Department of Social and Health Services, and Commerce and AmeriGroup. And Commerce has actually also signed a third-party administrator to help manage our rent assistance program, our tenant-based and project-based rental assistance program. Their name is H2 Consulting. And so I think I saw Christina on the line with H2, and so they'll be managing our portion of the rent assistance program for the Apple Health and Homes, and then we're working with our capital program on creating that bricks and mortar rent housing inventory. And then AmeriGroup will be doing the eligibility authorizations for the FCS providers. Want me to keep going, Scott?
No, I think that's great.
So, you know, everybody wants to know, like, okay, how much money are we talking about? You know, so in the operating budget in the this state fiscal year, we received $6 million in rent assistance. So we're issuing that through H2 Consulting for tenant-based and project-based vouchers. So that, you know, averages out to, you know, be around 330 individuals per year. So that, you know, we're hoping to hopefully increase that over the years. But that's kind of what the first year implementation looks like. And then we received $60 million in capital in the governor's budget. In the next biennium, we are asking for an additional $100 million in capital to create more permanent supportive housing units. And that can be new construction or acquisition. So you can buy properties or build new construction. And housing providers we want to, you know, it could be a mix where housing owner operators, you know, build the property and partner with FCS providers, or they could become FCS providers themselves. So it could be lots of different ways of how that looks. And then Apple Health and Home units and rental assistance will only be available to individuals authorized to receive FCS by AmeriGroup. Scott, I'll let you take this one.
Sounds good. So, you know, providers will be a really critical point for folks to be accessing the Apple Health and Homes program, the FCS providers. Supportive housing providers more specifically. And so the FCS supportive housing provider staff will complete a comprehensive assessment with that individual. It's going to look really similar or be, you know, the same exact piece of assessment that's used now. There may be an addendum or a light amendment to that so that we can get a little bit more information about housing preferences. But that assessment will be sent to AmeriGroup as is, you know, just the case now. Typically, those are submitted on the online assessment platform these days. AmeriGroup will authorize the housing benefit and services, and then the provider will leverage as many resources as possible for the housing transition to happen. And so you'll see the FCS Transition Assistance Program listed up there alongside HARPS and CBRA and GOSH, and then you'll see Apple Health and Homes. You know, really we're trying to say, stack, grade, sequence, all these resources that you're able to gain access to for the benefit of the enrollee in a way that, you know, maximizes all these resources. You know, TAP is an interim flexible funding resource, if you will, or a shorter term rental assistance program that can be flexed in a lot of different ways. HARPS brings people to FCS quite a bit, and HARPS has its own services and subsidy dollars as well. And so really just kind of thinking creatively in this space about what that individual's stated needs are and how they see themselves getting to the housing of their choice. And then remembering that these shorter term rental assistance programs are available to provide that support on their path towards Apple Health and Homes. And really, using those resources in a way that maximizes the overall housing stock or availability of the voucher types for the folks in the program or who are entering into the program. Melody, do you have anything you want to add there?
Nope, perfect. I think we really, want to braid resources and we don't want to duplicate, but I think there are definitely, opportunities to braid resources and one of the things as I'm learning about the capital side of housing and commerce is that, housing providers are really struggling with operations and maintenance of their buildings, that they build buildings and they need to be able to keep the lights on, and that the rent assistance that these programs provide sometimes are not enough to keep a steady, so long-term rent assistance is challenging for housing operators. And so I think the more we can look for ways to leverage resources and partner with those housing operators is a huge opportunity. So looking for ways for our FCS providers to partner with those affordable housing builders and operators. If you can go and have that partnership to provide the services within a housing building, a lot of these builders that are building are really salivating for partnerships because it makes their application look better when they are applying for capital funds. And so if you have that partnership to provide the services within the building, they're able to leverage the services that you're getting paid for under the Medicaid program, but it makes their application look better. And so how do we promote those partnerships more? And then you're able to leverage and braid resources. And my new favorite buzz for term is actually weave. How do we weave resources better together? But we also have to be careful and not duplicate and get into any financial discrepancies. So those are the challenges. I wish there was one main huge funding stream, but there isn't. There are all of these funding trickles that we have to navigate, and each one has its own eligibility. But that's why you guys are the experts, and the more we can train you and teach you about each of these trickles, and for you to be experts in how to navigate them and help your individual become eligible for them, that's what I hope we are able to help you do. Progress towards the launch. So we've been busy over the last several months. So the bill actually passed in the spring, and Department of Commerce did some reorganization, and the housing division was actually creating some separation within the housing division. Within Department of Commerce, they actually separated and created the housing division, a standalone division within Department of Commerce. And within the housing division, the Office of Apple Health and Homes and Permanent Supportive Housing was created. It's the first time where they've actually really had a unit dedicated towards permanent supportive housing. So it's really exciting. And I have some wonderful partners and team members, I think a couple on the call, where we are managing the CBER program, operations and maintenance, and really have a huge opportunity to dedicate time and efforts around launching Apple Health and Homes. But we are also really dedicating time towards expanding permanent supportive housing. So we're brand new. So we're really in our infancy. We're only 6 months old. So the Office of Apple Health and Homes is really a baby. So we've only been around for 6 months, but we've been very busy in the last 6 months and working very closely with our partners at the Healthcare Authority and at DSHS and AmeriGroup. But we've all been working very closely. We meet weekly and really hashing out how to operationalize these 3 legs of the stool. And so I know for us, some of the things that Department of Commerce that we've been working on is just creating our office, but preparing for, issuing the capital funds, getting $60 million in capital funds out the door. And so we work very closely with our other unit at the Department of Commerce, the multifamily housing unit. We also just issued a request for proposal for capacity grants that we're looking forward to announcing those awardees here soon. We also did procurement for our rent assistance third-party administrator on H2 Consulting that's going to be managing our $6 million in rent assistance. We also have we've created our guidelines. We did some listening sessions in partnership with HCA and DSHS, and that informed our guidelines. I think Kimberly put the link to our guidelines in the chat. We're still taking feedback. If you have, please take a look at the guidelines. If you have any ideas, suggestions, please fill out the survey. We want to hear from you on what you think about the guidelines. But that's sort of our guardrails for the program. So that link is there. And Scott, I'll let you touch on all of the things that you guys have been working on because you've been just as busy as we have.
For sure. Thanks, Melody. So yeah, over here at the Healthcare Authority, we've really been working internally to, map this process out in a way that, explores kind of the ins and outs of what needs to happen and when. Really also considering the current housing assessment, FCS Supportive Housing assessment and what that looks like, and if that, is bringing in the types of housing preferences of the enrollees that we need to actually be coordinating the housing through AmeriGroup. Also working on some contract amendments with AmeriGroup to include Apple Health and Homes and some of the processes and roles they'll be playing in the AHA process or Apple Health and Homes process. We're also amidst our negotiations with the Center for Medicare and Medicaid Services, or CMS. And some of the things that we're negotiating really will impact bits and pieces of the Apple Health and Home program. I think Melody earlier was speaking to how House Bill 1866 included specific timeline for authorizations and reauthorizations of FCS Supportive Housing Services, and that 1866 stated 12 months, and we are currently on 6 months reauthorizations, and currently we are still running on 6-month authorizations, and will continue to do so until or unless CMS approves. And then also just working through program policies and procedures, what it will look like for providers to actually be communicating some of these things with the enrollees. And I see that Kimberly has her hand up, so I just want to pass it over to her.
Oh, hey, I just wanted to let you guys know there is a question in the chat. Are you guys wanting to take that now or at the end?
I think we could do a Q&A at the end if that feels okay.
Okay.
Yeah.
Okay. But with that's what we've been working on over here at HCA, working really closely with Commerce, DSHS, AmeriGroup, and now H2 Consulting as well, to really come together and coordinate. I've both been an FCS Supportive Housing case manager. I was a case manager for over 3 years in the program. And I, feel like we're really moving forward here now at the FCS program within the state to be a really coordinated group, especially with Apple Health and Homes and FCS Supportive Housing Services, to make sure that all the subsidies, but not just Apple Health and Homes, but everything comes together in better alignment so that providers can gain access to these resources in a streamlined way.
And I do want to, I know AmeriGroup's been staffing up. They've been also, at the table talking about a lot of the, participating in a lot of these conversations. And we've pulled Whitney Joy and her team into interviews and all sorts of coordination meetings. And so there's just really been a lot of efforts between all of the entities to get us ready to launch. And I also just really want to call out the multifamily housing unit within Commerce, because they are also just have done a lot of work to get ready to launch the capital portion of the Apple Health and Homes, with preparing for all of the capital funding to get ready for that to go out. So just a lot, to get an initiative like this out in essentially about 6 months is pretty pretty impressive. There's still a lot to do, but everyone is working really hard to try and get this initiative out off the ground as quickly as possible. So some of the next steps and opportunities that we just also want to, say that the work is, there's still a lot to do. One of the first and foremost is there's still negotiations happening with the Centers for Medicaid and Medicare on the waiver renewal. Right now, HCA is operating under a 6-month temporary extension. And some of the things that are in the renewal application that they're negotiating with CMS is that those 12-month service authorization requests for FCS to be able to extend those authorizations to 12 months instead of 6 months. But they also, in the renewal application, are asking CMS for rental assistance for transition costs and some limited rent. And, it's really exciting. Every state kind of builds off of each other in these 1115 waivers. And recently, Oregon and Arizona have been able to have some successful 1115 waivers that have included about, I think, 6 months of some transitional rent assistance. So that is really exciting. And again, that is still in negotiations between HCA and the federal government. So we'll be poised and eager and cheering HCA on as they go through their negotiations with CMS. We also will be looking at the quality of services, and Apple Health and Homes is really a unique opportunity to provide quality services and pair Medicaid with housing stock and rent assistance. So we're going to continue to look at the fidelity to the model. So I know that HCA has been doing just a plethora of trainings to ensure that the evidence-based practice continuous quality improvement approach. Commerce is going to come in and enhance that with our own. So we also, I have 2 positions that just posted that will also be PSH trainers. We're going to take a little bit of a different approach. So we want to come in and enhance the work and work very collaboratively with HCA on their trainers. So the FCS trainers are focusing on the services and making sure that the FCS services are focused on the fidelity to the SAMHSA PSH model. Our trainers are going to come into the housing providers and the property managers and support them on PSH fidelity. And so hopefully we will work very collaboratively between the trainers, between HCA and the Commerce trainers. And so those 2 positions posted, go onto careers.wa.gov if you're interested in checking out those 2 positions. Just a shameless plug. Community capacity building. We always are looking at developing network capacity and building those partnerships. We actually just closed the grant that we just had, but I'm really, I actually just recently met with counties on how to expand FCS in your community. And it was really interesting to hear counties tell their story about their challenges with expanding PSH in their community, and the NIMBYism, the not in my backyard, and how to overcome that. And so we'll be looking at how to create some materials and training materials on addressing that, the effectiveness of permanent supportive housing. And honestly, one of the biggest hurdles that we heard was partnerships. The lack of partnerships between housing and behavioral health, the lack of workforce, how we, just everyone's experiencing workforce challenges. And so how do we create partnerships and build the capacity between housing providers, service providers? How do we continue to address those three legs of the stool in a way that each leg is being built at the same time and continuously, and that each leg isn't incongruent with the other ones, so that we have a lopsided stool. So definitely looking for ways of how we can forge and build those partnerships between those three legs of the stool. Anything I'm missing, Scott?
Oh, you did great.
You guys give me a PowerPoint and a microphone, and you guys should know better.
We count on it, Melody. We count on it.
Exactly.
I do want to share a couple of other opportunities with folks on the call too, in that as part of our work in Commerce, we are also creating, there was another bill that was passed in the last legislative session from House Bill 1724 that actually created a permanent supportive housing advisory committee. And the goal of this advisory committee, and I am so excited about this advisory committee, and I think one of the amazing and cool things about this advisory committee, and Representative Macri, who was the prime sponsor of this bill, is that the majority of people on this committee are people with lived experience. And so this advisory committee is really going to be helping advise Commerce in how do we expand permanent supportive housing and improve and look at the quality of permanent supportive housing. And so this advisory committee will basically be helping us kind of develop a strategic plan around permanent supportive housing in Washington State. And so that committee is open to the public. We do have a website on the Commerce website dedicated towards this committee. And our next advisory committee, which will be open to the public if you want to listen in, is February 24th. There's also another new revenue stream that folks should be aware of. And so this revenue stream is a new revenue stream that was created through House Bill 1277 in 2021. It is one of the document recording fees. And this portion, it's a portion of the $100 document recording fee that is going to be focused on permanent supportive housing, and it's going to be the Permanent Supportive Housing Assistance Program. It's scheduled to launch in July of 2023, and we are building the program. And essentially this program is statutorily required to go through counties. They have the right of first refusal, but we are doing stakeholder input, and we essentially want to hear from community-based organizations on how this program should look. And so we have a stakeholder event on February 7th. And I can put I'll put the link in the chat. I'll try and put the link in the chat in a second to this invitation. It went out to a lot of the FCS service providers, but this is a new program that will be, can look different in each community, because each county can essentially, well, that's kind of what we're building is, how should it look? Should we give the counties, the opportunity to decide? Should we be more prescriptive in how it looks? And that is essentially kind of what we want feedback on, is how should this program look? And so that meeting is February 7th. And then also just really encourage folks to check out the Apple Health and Homes guidelines. And that is posted, and there's a survey on the guidelines. We'd love to have your feedback on our guidelines and see what you think. So I think that's it. And I think we can open it up for questions.
Awesome. Thanks, Melody. Let me open the chat and we can start talking through some of the questions that came out of the session. So I'm gonna start scrolling through, and folks in the crowd, please, if I skip anyone, please highlight that. Looks like I'm gonna say Aiden Peterson has a question that says, since there are so many programs that have varying criteria for eligibility and how to access programs, is there a possibility of having some sort of supportive or / affordable housing roadmap put together and posted somewhere, centralized somewhere like, and then they put a wa.gov address for health and safety? So is there a roadmap already existing, or a centralized area where someone might be able to explore the varying criteria for eligibility to access these programs? I think one resource that I want to highlight that's pretty new, that can be a guide of sorts, is a discharge planning toolkit that was created by Kimberly Castle, who's part of the FCS team. And I'm going to ask Kimberly Castle to drop that link in the chat if possible, but that is one resource that I think could provide insight into eligibility as well as the path towards access. Thinking of other ones, we're working on a Pathways to Housing site right now, or refreshing the Pathways to Housing site, which will also list out quite a few of the current programs that are in existence over here through DBHR and other partnering agencies. And that will be a really good resource, both for enrollees and providers, as well as landlords. We're going to be incorporating a landlord piece to that website, so that landlords are also able to gain access to some information around some of the programs that are out there, and how landlords can become part of those programs in a way. Melody, do you have anything to add there?
No, I think that's great. It was kind of interesting because that came up at the counties too, as, could we create some kind of a roadmap on how to, create permanent supportive housing, and, maybe that matrix of, scattered site, project-based, what are the resources to, build that. And so, that roadmap idea is certainly something that's floated out, and, we'll certainly take that back. But I think in terms of direct assistance for an individual, I think the discharge planners toolkit is absolutely a spot on. If you're thinking about sort of strategic planning on how to expand PSH in your community, I think the roadmap idea is certainly something that we're going to be looking at trying to do systematically, to see how we can help communities expand PSH in their community.
Awesome. You see that Nona had a question. Can we get a list of resources to help get funds for rent that are available now? I think that Discharge Planners Toolkit, again, would be a really great resource for you and your staff, fellow staff, to visit Nona. It's a great tool to explore. And I think that through that tool, you'll be able to see not only what exists, but how one might be eligible for one of those programs, or all those programs that are on that toolkit.
I think it's also important, not to dismiss your partnership with coordinated entry. I think that, coordinated entry and it looks different in every community. And I think that that goes back to your relationships. Coordinated entry was intended, as a requirement from the federal government to try and triage, the limited resources that communities have to help individuals that are the most vulnerable. And so but in each community, it has, now come the triage for multiple sources of funds. And so it's kind of now the clearinghouse for multiple resources. And so I think as FCS service providers or any service providers, your first line of, your first option should be always coordinated entry. You should always, and I highly encourage you all to have a relationship with your coordinated entry. And so that is where a lot of the majority of resources are coming through coordinated entry. And it's really about how you develop those relationships and understanding of what the eligibility are for and helping helping understand what they're looking for in terms of the eligibility and the prioritization of the community. So each community can prioritize, who are the priority populations for their community.
Awesome. Jennifer, yes, the slides will be sent out after the meeting, so we'll make sure to do that. I see a question from Kristen. Once housed, can they continue to work with their original FCS provider? Yes, absolutely. That is per the Foundational Community Supports Program as it stands now. Client choice is central. If that person wants to continue being served by that agency that helped them enter Apple Health and Homes housing, absolutely. And if that housing is owned by another FCS supportive housing provider, that's okay. That person should be able to maintain the relationship with their agency of choice. Wondering, and I saw a few questions like this, Melody, and I'm wondering if you can address all of them. And I think this question encompasses all of them, but I'll check to be sure. Catherine Howell asks, wondering if the speakers can address if this collaboration might improve some of the scarcity of housing opportunities we experience in rural North Sound. And I saw some other folks just ask about access in rural areas more broadly.
I mean, access is everywhere. There, unfortunately, access to housing is not happening just in the urban areas. It is absolutely happening in every community in Washington State. There is not a community in Washington State that isn't experiencing housing challenges, housing stock challenges. I think the strategies, may be different in rural areas. You may not need a big capital 100-unit apartment building in a rural area. And so maybe your approach to, maybe it is acquisition instead of new construction in a rural area. Maybe you can buy a motel or a hotel, or maybe you can buy a single family residence and do shared housing. Shared housing is an acceptable approach to permanent supportive housing, as long as you still follow the fidelity in giving people choice in roommates, choice in, is that an environment that they want to live? So, it can be an option, in that menu of options, in that inventory. So I think that it can be a strategy. Particularly in rural areas where maybe construction is more challenging. One of the things I actually learned in commerce is there's actually capital infrastructure for communities I think one of the biggest things that rural communities struggle with is the infrastructure to, like, for sewers and, you know, getting the water lines and the, you know, for apartment buildings and things like that. And there's actually a capital program at Commerce that helps. It's in the local government division at Commerce. So there are capital infrastructure that helps communities with getting prepared for affordable housing development. And so, you know, maybe it's swimming upstream a little bit more to help the community cultivate the environment to apply for those grants first, to get ready for the application for the affordable housing units. So, you know, and again, looking at those options, maybe it's maybe it's a master leasing option. You know, maybe in a rural community, you approach a master leasing option where you approach and I think Healthcare Authority is actually working on a master leasing toolkit where you rent 5 apartments from an apartment building, and then you sublease to the individuals in your program. Maybe that's a strategy in your toolkit. So I think that you have a bunch of tools in your toolbox in those communities, and you pull out which tool meets the needs of that individual.
Wonderful. Let's see. Is the FCS housing subsidy considered transitional or permanent housing? And so, Dale, I'm going to assume you're asking about TAP, which is the Transition Assistance Program. That is an interim subsidy or shorter term flexible funding resource that is offered to supportive housing enrollees, or FCS supportive housing enrollees. If you're asking about Apple Health and Homes more broadly and the voucher types that are connected to the program, those are permanent vouchers. So those come in 2 forms. There's a tenant-based form of a voucher and then a project-based form. And both of those vouchers are permanent vouchers for that individual. And if that person no longer would be interested in FCS supportive housing services, I think I saw a question about that a little bit further down. You know, that's that person's choice, and that is something that we would honor, and they would not lose housing. And that's a really critical question to ask, right? Because that is something that people have the option to do. Again, that is totally allowed. And we have a separation in this program between the rental assistance portion and then the service portion. So H2 Consulting, who's contracted with Commerce, is managing the rental assistance portion of the program and also the inventory of housing in a way. And so they really maintain those payments or in collaboration with Commerce to make sure that housing is available to someone, and the service side is on the AmeriGroup side. And there is communication between H2 and AmeriGroup, but it's really to transmit housing preference so that that provider and the enrollee can identify their housing of choice. Melody, do you have anything to add there?
Yeah, the only reason they would lose their housing is if they went and, you know, won $1 million, you know, just that income eligibility. There still is an income eligibility, but as long as they are income eligible, but if they choose to, you know, if they lost their Medicaid, you know, that, or choose not to receive FCS services, they don't lose their housing. It's only if they went out and got, you know, won $1 million and are no longer income eligible and meet that 30% AMI, that they would lose their housing voucher, which would be great. Fantastic.
Yeah.
Wonderful. That's a celebration.
Hey, Hannah, I see your comment. It says it may be something to consider that not all organizations operate the FCS program or that operate FCS have launched TAP funding or have plans to launch TAP. We are seeing more and more of our FCS enrollees changing providers to agencies that have TAP. And I really appreciate that feedback, Hannah. One thing I want to highlight is TAP has kind of shifted from its original launching point, which was agencies had to submit request for reimbursement, and agencies had to pay upfront and get that reimbursement. There are now ways to request funding upfront. You know, I know that does kind of not solve the issue that you're kind of highlighting here, but just want to mention that and would love to connect with you outside of this meeting if possible to talk through that. I know, you know, I think there's great opportunity at the agency that you work at for TAP, but also understand there might be some hesitancy and would love to explore that with you and the staff there. So I'll probably be reaching out today, just so you know, Hannah. Go ahead, Melody.
I just want to, you know, emphasize that, you know, we can't duplicate, because this actually was brought up, and I was talking with someone, an organization that I know, and some colleagues that I used to work with, and there was some confusion about TAP and CBRA, and you know, CBRA, or Community Behavioral Health Rent Assistance, is also another long-term rent assistance program that we manage here within Commerce, that my colleague Danny Rylander manages, and Jeff Spring manage here at Commerce. Those long-term rent assistance program funds go through the BHASOs. So those are also should be leveraged. Many individuals in the FCS program would be eligible for the CBRA long-term rent assistance program, and the question came up that they didn't think that if you were on TAP that you couldn't receive CBRA. And I think that what we want to make sure that folks understand is that you don't want to duplicate, you can't duplicate, you know, but if you're coming out of the hospital and, you know, TAP is really intended to get that person out of the hospital and into an apartment, you know, pay that first and last month's rent, deposits, get them out of the hospital, get them out of that inpatient setting. And then the long-term supports like CBRA, like Apple Health and Homes, can then pay that long-term rent assistance. And so how do we use like programs like TAP, like HARPS, and other, you know, transition, you know, rent assistance, housing recovery through peer services, to get individuals out of those inpatient settings, pay those first and last month's rent deposits, and then use those longer term rent assistance programs. So we don't want to duplicate, but we want to leverage those programs. Some of those programs are transitional, and some of those programs are long-term rent assistance programs, and how to leverage the two of them together.
Thank you, Ms. Melody. That's great. Let's see. Is there HARPS funding available anymore? We haven't had any luck with them. Hi, Kyra. Yes, I believe HARPS funds are broadly available, but in some regions, certain regions may be out. And I know that there are a few regions that are currently in the midst of trying to identify a new contractor. If you'd like to reach out to me to get a better update than that, I can connect you with Wanda Johns, the HARPS program manager, and I would be happy to do that if you want to shoot me an email, Kyra. Let's see. Is there a community of practice or work group that is working on system mapping and resource grading, or could there be one started that Aiden or Aiden could join? Melody, I'm wondering if there are any work groups that are happening over at Commerce that are public facing that kind of explore that currently, or the current landscape of services and subsidies or permanent supportive housing. And if not, kind of thinking about some of the opportunities on this side for a second.
I'm sorry, I think I missed the first part of it, Scott.
Oh, no worries. No worries. So someone asks, is there a community of practice or a work group that is working on system mapping and resource grading? Or could one be started and joined? So one thing I want to plug real quick, Melody, is something that me and actually Danny Rylander, who Melody just mentioned, and Whitney Joy Howard from Alta have been working on continuously, is pulling not necessarily a work group together, but I think that is in the future in a way, You know, we held a session at the Conference on Ending Homelessness this year to really kind of hear from providers about what they're experiencing across the system in air quotes being, you know, the housing services and subsidies that serve folks that are experiencing behavioral health challenges. And we heard a lot of great feedback around, you know, wanting to identify eligibility criteria for certain programs and kind of the fragmentation or the feeling of fragmentation of the system. And I think that, you know, our aim for doing that was really to launch into some better coordination. And I think I kind of mentioned that a little bit earlier in this conversation too. And I think that what I'd like to do is connect with them and try to generate some ideas around what you mentioned here, because I do think it could be a really great next step for us, especially across agencies to come together and really be building something out like this as Apple Health and Homes comes into the picture, because there's a lot out there, and there's a lot out there for folks to retain. And we all know that retaining all that information and then connecting folks can be a really difficult challenge. And so I'm going to take that back to that group, but I'll pass it to Melody to see if she has anything to add.
There's a lot. Let me first start with so there's the Affordable Housing Advisory Council, which is the governor's appointed advisory council, is doing a 5-year strategic planning looking at a needs assessment for affordable housing. There's the governor's advisory council on homelessness, I think, that's doing some, you know, gaps analysis, and that's also a public meeting. There's the Interagency Council on Homelessness. That's sort of a joint meeting with the Governor's Advisory Council. There's also the, you know, HCA contracted with the Washington Low Income Housing Alliance to create the Behavioral Health Action Plan. That also did kind of a needs assessment and created a number of recommendations around sort of a action plan and identified where the gaps are. I think the SURSAC around the substance use has identified a sort of a housing action plan and a gaps analysis and a needs assessment. The Ruckels House has created a, you know, what are the which is actually a really interesting report on what's the root causes of homelessness. And they look at from a macro and a micro approach to homelessness, and what are, you know, looking at what are the systemic issues around homelessness, and what are the micro causes of homelessness, and what do we need to do to address it. So I do think there are a lot of things out there to basically, so I feel like there's a lot of, let's analyze it, let's look at it, let's talk about it. And maybe that's a little bit different than sort of the inventory of the resources, which I actually kind of think HCA did with I think the inventory of what the resources are is probably best categorized in either in each community in 211. Actually, you know, 211 is probably your repository of resource, you know, the best repository of resources that you can get. But I think even the discharge planners toolkit is also just a repository, you know, an inventory of a lot of resources. So I wouldn't, you know, I just discourage us from spending a lot of time on duplicating efforts of all of these things on needs assessment, gaps analysis. There's a lot of that that's happening right now. It's a little overwhelming, actually. It's how do we take all of that information and come up with a plan to harness all of it and do something about it. I'm an action person. I want to do something about it.
Awesome. Thanks, Melody. Looks like we only have about a minute left. I'm going to ask one more question, and I think that Melody, you might be able to answer this. It's from I believe Dia Brower. If I understand correctly, if a client is approved for FCS then they have access to all these programs without an individual contract with the county or agency? Or do we have to have contracts for each of the programs available? So it sounds like Dee is asking if they need a specific contract for Apple Health and Homes. And I'll be able to answer that. You know, we will have a specific Apple Health and Homes contract coming from, or amendment, if you will, coming from AmeriGroup, so that agencies can begin serving folks with that Apple Health and Homes program. FCS Supportive Housing has its own contract that comes from AmeriGroup to a provider of the services. And then there's a separate TAP contract amendment. There will also be an Apple Health and Homes contract amendment, I believe. Melody, do you have anything you want to add there around like any sort of potential sorts of relations between a provider and rental assistance piece, or the landlord, and who would be kind of contracting with them?
I think, I think just that, given the resources available, I just want to, be, a reality check. I think there are 8,000 people enrolled in FCS Supportive Housing. I think we, gave the estimate about to start with 300 to 330 people in year one that we would be able to serve with the rent assistance program. Our capital program is hoping to launch in February. That's a year to potentially 2 years to either acquire or build housing. So again, our legs of our stool are not going to be symmetrical. Our services are definitely, are out in front and going well. Our leg for the rent assistance is getting a little bit better, but the leg for the capital is going to be the shortest for quite a while. And so we, will certainly hope to bring those other two legs equal eventually, but they're not going to be as equal to the FCS leg for quite a while. And those resources, as those resources continue to grow and we continue to build and expand the rent assistance and the tenant-based rental assistance, we hope to serve more people. But again, it starts with you all identifying the landlords, or we're also going to be working with projects to identify project-based rental assistance and be able to start building that inventory.
Awesome, thank you for that, Melody. And with that, I think we have some more questions to answer in the chat, but I think what we'll do is come together across agencies, so both Commerce, HCA, and DSHS, and I, or we'll all come together and answer those and respond to folks by email. And that will take us a moment, but please do expect to get some responses here over the next week or two. And with that, that is all we have to present on Apple Health and Homes today. Again, I just want to thank Melody Pazel for joining me in this conversation around Apple Health and Homes and really laying out what the program looks like right now. And so thank you, Melody. And we hope to have you back soon and talk through more of this. And we got great feedback from the crowd today, and we really do appreciate your participation. Expect more information to come down about Apple Health and Homes. And in the meantime, if you have questions, don't hesitate to reach out to us by email. Our emails will be in the slideshow that will be sent out as a follow-up. And we just want to thank you again for being here. Have a great day, everyone.